In other news, the state announced a temporary reprieve today for Micronesians just a day before the state planned to stop covering dialysis treatments for about 100 low-income kidney patients. KITV's Keoki KERR is here with the latest developments. Keoki?
Well, Pam, the state says it's going to tap federal Medicaid funds to cover low-income dialysis patients here for another 2 years, because the state says it doesn't have tens of millions of dollars to keep covering these people when the federal government pledged to take care of them decades ago.
About 24 Micronesians gathered in the governor's ceremonial office the day before the state is shifting many of them to cheaper health care coverage that would have no longer covered dialysis treatment. State Human Services Director Lillian Kohler plans to use federal Medicaid funds to reimburse the state for the last 2 years of dialysis coverage, getting about $3 million. That's enough money, she says, to cover the 100 or so Micronesian dialysis patients for the next 2 years.
So that's very good news. Nothing will change as far as kidney dialysis goes for at least the next 2 years.
Dialysis.
When translators explain the news, people here applaud it, but they're worried about the long term.
I would like to see a permanent solution, not just 2 years. I'm terribly sad that we're only talking about at least 2 years. That's a dagger in the heart.
They're also concerned about another 100 or so cancer patients because now name-brand chemotherapy drugs won't be covered by the state, only generic drugs. But the state said hospitals have to cover the costs of anyone who can't pay.
For those patients who currently receive their chemotherapy because they're in a hospitalized situation, they will continue to receive the treatments as they do today.
The governor says the federal government should pay for health coverage for Micronesians and others who are covered by the Compacts of Free Association because the U.S. government conducted nuclear bomb tests there in the 1940s and 50s.
The legacy of your nation with us has been destruction, benign neglect, and indoctrination. Our boys are fighting in the war in Iraq. Are we going to tell them, my nephew, that I cannot get service?
Congressman Neil Abercrombie has proposed an amendment to offer Medicaid coverage to legal migrants from Micronesia, Palau, and the Marshall Islands for the first time. That could help solve the problem in the long run if Congress approves the change. Keoki KERR, KITV4 Island Television News.